Niacin's remarkable affordability is one of its greatest public health advantages and, simultaneously, one of its biggest commercial handicaps. In a healthcare ecosystem driven largely by profit motives and intellectual property rights, natural compounds that cannot be patented, like niacin, are systematically underpromoted, underfunded, and underutilized. Despite its vast therapeutic potential in conditions ranging from cardiovascular disease and neurodegeneration to skin cancer and chronic fatigue, niacin remains relegated to the back shelf of medical interest, not because it doesn't work, but because it doesn't pay. At the core of this issue is the pharmaceutical industry's economic model, which is built around patentable molecules that can generate exclusive profits. Niacin, being a naturally occurring vitamin, cannot be patented in its unaltered form. That means no exclusive rights, no markup control, and no guaranteed return on investment for the millions of dollars required to run clinical trials. Without that economic incentive, pharmaceutical companies divert their resources into synthetic analogs, modified derivatives, or completely unrelated drugs that can be owned, priced at a premium, and marketed aggressively, regardless of whether they offer superior efficacy or safety compared to niacin itself. A classic example of this is the case of cholesterol management. For decades, niacin, in the form of nicotinic acid, was recognized as one of the most effective agents for raising HDL, good cholesterol, while also lowering LDL and triglycerides. Yet in recent years, statins have completely eclipsed niacin in both prescription frequency and clinical funding.
Why?
Because statins are patented, profitable, and backed by billion-dollar marketing campaigns. Niacin, by contrast, costs pennies per dose, cannot be patented, and causes a benign but unpopular side effect, flushing, that makes it difficult to push as a mass-market pharmaceutical. Clinical trials like AMHI and HBS2, Thrive, while often cited as reasons to abandon niacin, were designed in contexts where patients were already on statins, and the flawed conclusions of those trials further reduced interest in niacin without acknowledging its unique mechanisms or standalone utility. The same pattern is evident in the anti-aging field. The surge of interest in NAD+ and sirtuin activation has led to heavy promotion of proprietary compounds like NR, nicotinamide riboside, and NMN, nicotinamide mononucleotide, both of which are essentially designer derivatives of niacin. These compounds, which can be patented and sold at high margins, have become the darlings of longevity research. Yet niacin itself, which also increases NAD+ levels, often more reliably and at far lower cost, is scarcely mentioned in the same breath. This isn't a reflection of inferiority. It's a reflection of profit-driven bias in research prioritization and public education. Even when niacin's effectiveness is clearly established, such as in the prevention of non-melanoma skin cancers, mitochondrial repair, or neuroprotection in Alzheimer's models, it fails to receive the clinical momentum it deserves. Most physicians are simply never taught about niacin beyond its historical link to pellagra, and certainly not about its nuanced biochemical roles in DNA repair, oxidative stress reduction, or energy metabolism. The result is a gaping hole between what science supports and what medicine actually applies. Research funding also mirrors this skewed reality. Universities and research institutions rely heavily on grants, many of which are tied to corporate sponsors or pharmaceutical partnerships. Since niacin isn't profitable, there's little incentive for companies to fund the large-scale randomized controlled trials needed to elevate it into clinical guidelines. This absence of data becomes a self-fulfilling prophecy. No funding means no trials. No trials means no clinical recommendation. No recommendation means no usage, and the cycle of obscurity continues, even when the biochemical logic and real-world benefit are strong. It's also worth noting that niacin's low cost makes it ideal for public health deployment, especially in low-resource settings. But because global health policy is often shaped by partnerships with industry players, even here, niacin is frequently overlooked in favor of more profitable or headline-grabbing interventions. A molecule that costs a few cents per day and helps repair mitochondrial damage, modulate hormones, protect neurons, support skin health, and lower cardiovascular risk should be a cornerstone of preventative care. Instead, it's a footnote. In a rational, evidence-driven medical system, niacin would be championed as a frontline nutrient with broad-spectrum therapeutic value. Instead, we live in a profit-driven healthcare landscape where visibility is tied not to effectiveness, but to marketability. Niacin is not flashy. It doesn't carry a trademark. It doesn't command high prices. And so, it's ignored, not because it's weak, but because it's financially inconvenient. Ultimately, the neglect of niacin is not just a missed clinical opportunity, it's a reflection of a deeply flawed incentive structure in medicine. It's a warning that evidence alone isn't enough to drive healthcare priorities. Economics shape what gets studied, what gets prescribed, and what patients are told to value. If a nutrient as powerful, safe, and affordable as niacin can be buried by commercial apathy, how many other solutions are we ignoring simply because they aren't profitable? Until we recognize and address these structural biases, vital interventions like niacin will remain in the shadows, quietly effective, woefully underutilized, and obscured by the glow of more expensive, less proven alternatives.